So our next speaker is Dr. RAJU MUMNADA. He is practicing at Aurangabad at his own hospital, MUMNADA ENT and Eye Laser Center, and he is also director in Elite LASIK Laser Center at Aurangabad. He is also honorary treasurer of Maharashtra Ophthalmic Society, and he will be speaking on critical study of some important court judgments related to ophthalmology, lessons to be learned by us. Yes.
Good morning, everybody. At the outset, I would like to thank Dr. Viral for including me in this very important instruction course regarding medical legal aspects. So I'll be talking about critical studies of very important court judgments related to ophthalmology and the lessons you can learn out of it. As already mentioned in previous talk, Honorary Supreme Court has observed that for every mishap during medical treatment, doctor cannot be proceeded for punishment. But unfortunately, these lawsuits, they are increasing against doctors mainly because consumers, that is patients, their expectations are getting higher and awareness has increased among patients. And at the same time, the tolerance threshold has gone down. So it is need of our that as a doctor we should have knowledge about these legal aspects. And this knowledge we can gain by studying different important court judgments against ophthalmologists. So in this talk, we are going to discuss about different important cases, observation of courts and lessons from these observations, because you do not make all the mistakes to learn. You can learn from others' mistakes. So case number 1, patient underwent cataract surgery with IOL. Afterwards, patient complained of pain, headache and vomiting. He attended ophthalmologist and he rightly diagnosed as endophthalmitis. Immediately, patient was referred to VR surgeon where he underwent vitrectomy. But unfortunately, patient lost his eye and doctor was sued for that. National Commission observed that doctor was qualified, skilled, experienced ophthalmologist. All the tests, important investigations, fitness, all this was taken. He was rightly diagnosed and in time referred to VR surgeon for further treatment. By quoting Jaffe's cataract surgery and its complications, National Commission observed that there are several causes of post-operative endophthalmitis and doctor cannot be responsible for all these endophthalmitis. Case number 2, during cataract surgery, patient developed PC tear. Vitrectomy was done. Patient regained vision by 6/6, but eventually patient developed RD. Surgery was again done, but he developed endophthalmitis and lost his vision. Doctor was sued, but National Commission did not find doctor responsible for that. Observed that for every mishap during medical treatment, doctor cannot be proceeded against punishment, and any procedure done in good faith for benefit of patient, although it's without consent, it's not an offense, though that is causing harm to patients. So lessons we can learn from these two cases that doctor cannot be negligent if he or she is qualified, skilled and experienced, if he adopts practice pattern approved by a responsible professional body, and he cannot be negligent just because complications has occurred. Case number 3, patient was operated in free eye camp and he developed endophthalmitis and lost his eye. But National Commission observed that this being a free eye camp, it doesn't come under the CPA Act, and the case was dismissed. So all these government hospitals, healthcare center, dispensaries which are providing free surgeries, free services for all patients, whether patient is poor or rich, it doesn't come under the purview of CPA. Case number 4, patient had congenital eye disease. Doctor explained guarded visual prognosis and he was advised to get laser treatment at Eye Institute, but patient got operated for the cataract and he didn't listen. But he didn't regain his vision. and patient filed complaint against doctor. In this case, National Commission observed that there was contributing negligence from patient because he didn't listen to doctor, and doctor was not negligent because he was rightly diagnosed and he was explained about the guarded visual prognosis. So, as already discussed by Dr. Rajesh Shah sir regarding record keeping, we should maintain all the records properly, even records including treatment refusal, investigation, surgery, everything should be maintained. Case number 5, patient post for cataract surgery. On table, patient had expulsive hemorrhage and lost his eye. But National Commission observed that as per affidavit from a very renowned VR surgeon, this expulsive hemorrhage is known complications, although it is dreaded in intraocular surgeries. So doctor cannot be negligent for that. Case 6, young patients aged 14 years was advised radial keratotomy. And he was operated for same, but vision did not improve, and eventually patient developed RD and lost his vision. Litigation was filed against doctor, but in this case, as patient's age was less than 18, and literature shows that patient cannot be operated in below 18 years of age for refractive surgeries, and doctor was found negligent for the same. So this negligence is breach of duty arising due to commission of act which no prudent or reasonable doctor under similar circumstances would do. So I'll advise not to go for unindicated procedures to avoid these litigations. Case number 7, diabetic patients who had progressive diabetic retinopathy and posterior polar cataract. Poor prognosis was explained to patient. Left eye was operated for vitreous hemorrhage, right for cataract, but patient did not gain proper vision, and he was patient has filed a case against doctor. But commission observed that loss of vision was not because of surgeries but because of diabetic retinopathy. Doctor has managed the case as per standard medical practice efficiently, and doctor was not found negligent for the case. So always follow standard medical practice. Doctor cannot be answerable for any treatment which has gone untoward results. He is not an insurer, and he cannot give warranty of his treatment, and he is not responsible for all the accidents. Case number 8, known case of diabetic patient operated for cataract. Next day he had swelling and pain in operated eye, diagnosed as endophthalmitis, and patient lost his vision. But in this case, doctor did not record his basic blood sugar level, and fitness was not done, and that's why he was found negligent for not maintaining record and not doing basic fitness. So preoperative basic tests like blood sugar level, fitness, all these should be done, and all these tests should be in permissible limits, and you should maintain that record. Case number 9, patient operated for pterygium. After 1 week, mitomycin C was prescribed to prevent recurrence, and doctor orally told patient to stop mitomycin C after 2 weeks, but it was not written on the paper, on prescription on record. Patient didn't understand this, and he continued mitomycin eye drops for more than 4 months, and eventually he developed xerophthalmia and went in court. In this case, both doctors as well as patient were found negligent. Doctor was found negligent just because he didn't give it in writing, and patient did not show up to doctor after 2 weeks. Therefore, patient was also had a contributory negligent about this case. As already told by Dr. Rajesh Shah sir, medicine should be prescribed in detail, like dosage, number of days to be used, in which eye to be used, and it should be in legible handwriting, and record should be well maintained. So take home message: do necessary investigations and keep records. Explain the prognosis and take in confidence patients as well as relatives. Informed consent in mother tongue, as already told by Viral Shah sir. It's must. Treat the patient as per textbook norms. Refer to patients to higher center if you feel, and be transparent and polite with patients and relatives. Before I conclude, I'd like to specially mention Dr. A. Deshpande sir, the legal consultant for AIOC, for his all help and guidance in this talk. And I'd like to appeal everybody to go through his his CME published by AIOC, that is Legal Aspects in Ophthalmology. It's available online on AIOC website. It's crisp. It's briefly. It has everything has been mentioned in this case. Thank you all. Thanks for patient listening.
Thank you so much, Dr. Raju MUMNADA, for such an excellent talk on this various landmark court judgments.